I guess you know this place by now, but we're back in the lab, and it's our 24-hour adjustment on the immediate lower that we placed in the new upper denture on our patient using the closed system and the Lang flask at 24 hours, which to me is the most critical appointment of the entire branching technique. Because at this appointment, we're going to adjust any flanges. We're going to back up if we have to. We're going to adjust the occlusion and make sure that the bite blocks are working the way we want. And so when she came in, she had not taken her denture out for 24 hours. Well, not 24 hours, but all night. And I tell patients all the time, if they take their immediate out, they won't be able to get it back in. What this does for us is it inhibits swelling. She did really good. She's very sore, which we've all been through this with patients. And so the first thing we do is get them up after I've taken the dentures out of their mouths, and we let them rinse their mouth out with cool water and a little bit of mouthwash, because that's really what they wanted to do all night. So we'll have Taylor come in here close, and I'm going to show you a couple of places that I really feel like we need to adjust. If you'll notice, on the lower, we got really great borders forming. This woman has almost no ridge on her right side. But what you'll notice is how thin the flow cast is in this area. And that would be kind of under the tongue. I asked her if she was real sore, and she said, I'm sore everywhere, so I can't really tell. And so I'm just going to kind of hollow grind this whole area and put some fresh flow cast in there. We check the occlusion, it's spot on. A couple of places I want you to notice. This is a really good border here for load-bearing areas, the external oblique ridge. Same thing over here. We're getting a really nice border over here. Main stress-bearing or load-bearing area of a denture, external oblique ridge. We got a little bit of a nice border here. I'm going to thin this down in through here with my hot knife. And so those are all the little things that I'm looking for. Yesterday I adjusted this little area, and you'll notice that flange is not sticking out anymore. That's the place where a patient will tell you is rubbing the side of their tongue. There's a little bit I might back up right there, that little soft spot, but I may not. When we take a look at the upper, if you'll remember from yesterday, I adjusted right in through here. Let me put my glasses on. And I've got a nice thickness of flow cast here. But I'm going to thin this down a little bit, and I'm going to thin this down. There's a little excess right here. I'll use my hot knife to get rid of that. The other place we adjusted was right back here, and I'm going to need to do it again. Get a good close-up of that. A good close-up of this. That edge is still sticking up through the flow cast. And that's really going to be uncomfortable in that turn where the tuberosity is. If you look at this side, it's not like that. We have flow cast there. So I'm just going to drop that border down and then paint a little flow cast back in here to cover that up. I might adjust this a little bit, but I got a pretty nice thickness of flow cast. I'll just thin this, and I think that'll be more comfortable to her lip and the drape that she'll have over her lip. She's really solid. I had a hard time getting it out this morning. And for a patient that has combination syndrome, that's a real benefit. We had talked to her about the possibility of placing some implants in the lower. But I'll be honest with you, sometimes we get them to where they just don't need them. And she and her husband said that they'll do it if they have to. And so the door's still open on that. I'm going to be doing a couple of classes at the Hinman on overdentures and implants. And so we may use this lady if she wants to put some implants down here for that Hinman next March, I think it is. Charlie and I are going to do a hands-on course on overdentures and electric course on overdentures using implant overdentures. So put that on your calendar and come hang out with us, and we'll try and answer all your questions. So let me do my adjusting, and then we'll show you what it looks like in a few minutes. Okay? Now, one of the things I really like about Flowcast, which is very different from Hydrocast, is the ability to adjust the denture and the Flowcast with a rotary instrument, and this is my favorite. Let's get a little zoom in on that. And it's this round burr. Charlie had them down in the lab, and so I grabbed a hold of one day, and it trims and gives you a concave surface to accept the Flowcast. And with Flowcast, it's not going to grab like Hydrocast used to do and sling material all over the place. So let me go ahead and crank this up, and Taylor will get close and watch how I'm going to get that little concave surface with this burr. Now, I'm not sure what this burr is called, but what we'll try and do is put it on the Flowcast website and see if you can, Taylor will find out and post it on the website. Okay, let's give it a try. For all of you that have ever trimmed Hydrocast, you may be in shock right now. Because as you can see, it's not pulling all of the Flowcast out. And if you look at that surface I'm getting, the surface that I'm getting is that concave surface. Now that's going to support the Flowcast in that little cup. And then, as I said, I wasn't necessarily going to adjust this, but I think I'm going to do it. And put a little touch of Flowcast right there. Watch this, guys. If you'd have tried that with Hydrocast, you'd have ripped all the Hydrocast right out of that denture. Okay, now on this lower. With the closed system, Charlie relieved the inside of the denture after he put it in the Lang duplicating flask. And so it really minimizes the amount of adjustment that you have to use. And you might notice that I'm not having to adjust the flanges a lot. I'm not having to adjust this a lot. And that's because of that closed system. If we were using the open system, the stone cast, the borders wouldn't nearly be like this. And so I really like this approach. Now, the sublingual frenulum, she's still kind of swollen and it's going to be really sore down there. But I know there's a sublingual frenulum there, right? So what I'm going to do is change my burr out, and I'm just going to hypothetically put an area for the sublingual frenulum. And if you figure it's probably pretty much right in the middle, then what I'm going to do is come in here and with just an acrylic burr, I'm going to create a place, and I'm going to make it a little wider than I normally would. I had a prosthodontist from Atlanta in here for one of my courses, and When I started grinding on it, on the flow cast, old Harry McCool says to me, man, that's a game changer. And I think you'll all appreciate Harry's comments. Now what I'm going to be able to do is put a little flow cast in there and let her tongue kind of sculpt it for me here. I'm going to blow this off, Taylor. The other place I'm going to adjust is right there. You can kind of see the pink showing through, and that's right over her retromolar pad. I'm probably going to adjust this one a little bit too. So I'm going to switch back to my little round burr. That's not a little round burr, by the way. It's a big round burr. What I'm going to do is I'm just going to go in and kind of give a little pivot for the flow cast to reside. Retromolar pad. Dr. Pete Dawson would call this the brick-like stock. I'm going to thin these borders down a little bit too, just so that she doesn't feel like the Godfather with cotton rolls in her cheeks. Okay, so now what I'm going to do, anytime I add flow cast to flow cast, I will take a 2x2 sponge, a little bit of chloroform. I'll dampen that sponge slightly. Always close the top. And in the areas I'm going to add flow cast to flow cast, look what it does. It dissolves the surface of the flow cast for just a minute, so that when I come back and add, it's going to adhere to itself much better. And in these areas, get those pencil marks off too. I'll be able to get it to really get a homogeneous kind of bond to the existing flow cast. That's the trick, by the way, I learned from Jack Turbyfield, Jack the T. Okay, so now we get a second, or a mix of flow cast. We go ahead and spot these in, check the occlusion one more time. It should be ready to go.